Cancer. The word brings the images of death in front of our eyes. However, testicular cancer is altogether different. It's a highly curable cancer to the tune that 80 to 95% of the patients who are diagnosed with testicular cancers can be cured with the treatments as available on today. Hi, I'm Dr. Sandeep Batra. I'm Director Medical Oncology at Max Hospital, Saket and Gurugram. I take care of the cancers with chemotherapy, and testicular cancers is one of my core interest areas. Today we will discuss about the testicular cancer and its treatment. Testicular cancer is a cancer of the males. As you know that the testes are there in the males. Any tumor that develops in the testes is known as a testicular cancer. It may start in the testes, but if not taken care of well in time, it can spread to the opposite testes, can spread to the abdomen, and if further not taken care of well, can spread to the rest of the body systems, including lungs, liver, brain and bones. And that's why, despite being a highly curable cancer, if you do not take care of it well by getting the appropriate treatment, it may create havoc leading to mortality, that means death. So, a timely intervention with a timely diagnosis and a timely treatment can save almost 95% of the testicular cancer patients who are in the prime of their productive as well as reproductive age. Testicular cancer may manifest with symptoms like pain or swelling or dragging sensation in the testicular region or the scrotal region, or there may be some swelling in the inguinal area, and in the later stages may also present with the backache. Sometimes testicular cancer may present silently with a simple swelling which is drawn to your attention while bathing, and there is no pain, no other problem. So whenever you have any swelling in the testes that you have noticed while bathing, while riding a cycle, motorcycle, please bring it to medical attention, because it may be the starting point of cancer, which if not taken care of well may increase in its stage, leading to dissemination in the body and leading to much problems in the life, including the costs and the toxicities of the treatment. We just talked about the symptoms of testicular cancer. Coming to the causes, testicular cancer, in contrast to the other cancers like lung cancers, who are more common in the smokers, doesn't have any well-defined cause. However, it is seen that it is commonly seen in persons who have had undescended testes at birth. You might be knowing that the testes, when we are in the womb of our mother, they reside in the abdomen, and as we are born, they descend down to the scrotum. So those males whose testes have not descended with the birth, they have more chances of developing this cancer. The second thing is that those who have a family history of a testicular cancer, for some unknown mechanisms, also have an increased risk. There is no other known cause which could tell that a person can develop testicular cancer. Neither smoking nor alcohol, which are the causative factors in most of other cancers, has not been implicated for the development of testicular cancer. So in the absence of knowing any particular cause, prevention is the best thing, and you have to be aware about your body, about your testes, to diagnose this tumor and get yourself treated in time. Prevention is always better than cure. However, testicular cancer is preventable in only 5% of the patients, those who had undescended testes at birth. The remaining 95%, early detection is the only way forward. And early detection is very simple. Once a week or once a month, testicular examination, that is self-testicular examination while taking a bath, to notice if there are any painless or painful swelling. If you find it, please get it medically examined, and if it is diagnosed as testicular cancer, get a timely treatment for the same, so that more than 95 to 100% chance is there that one gets cured. However, if you are able to diagnose it in the late stage, still you need not worry, because despite being in advanced stage, testicular cancers are treated so well these days with all the modalities of treatment that 85 to 95% of the patients get cured despite being in advanced stage. So if you diagnose it well in early stage, it's good. However, don't despair if you are not able to diagnose it in early stage. Despite a late stage, the treatment can give you a survival as good as 85 to 95%. So treatment of testicular tumor can be as simple as removing the testes which has the tumor, which is usually in the early stage or stage 1 tumors. The treatment can be as complex also, using the surgery for removal of the testes, using the surgery for the removal of the lymph nodes in which the testes drain, using chemotherapy and using radiation therapy as well. So please understand, an early stage tumor, only surgery is the curative treatment, given a 98% chances of cure. However, those patients who have an advanced stage 2 or 3 or in some patients 4 disease, we need to employ all the modalities which can take care of the cancer, that is surgery, radiation as well as chemotherapy. And despite an advanced stage 2 patients 95% cure rates, stage 3 patients 90% cure rates, and even in stage 4 patients you can have 75 to 85% cure rates. So it reinforces that early diagnosis of testicular cancer, which is in your hands, can lead to a better survival outcomes. However, despair should not be there if it is unfortunately diagnosed in the advanced stage, in which using the surgery, chemotherapy and radiation therapy, a large majority, which could be as large as 85 to 90% patients, can be cured. So in contrast to other tumors like lung cancers, kidney cancers, in which survival hardly reaches about 20, 30, 40%, testicular cancers have a prognosis and outcome which is as good as 95 to 100%, provided it is timely and it is properly treated. Testicular cancer happens in the males in their most productive and reproductive age group, that is 15 to 30 years of age, and the diagnosis is as easy as taking testes in your hand. If you do that, you are able to diagnose it in very early stage, making it possible to get a 100% cure rate. Even if it is not diagnosed early or it is diagnosed in the advanced stage, 70 to 95% patients do get cured. I hope you find this information useful. If you have any doubts, any questions, any comments, please write them in the comment box. Thank you.